Okay, so this is going to be my week 4 health assessment 2 video, and this is going to be over my neuro exam. So the first thing I'm going to do is just acknowledge my patient, well, knock on my door, acknowledge my patient, do my hand hygiene on the way in, introduce myself, explain to them what I'm about to do. So I'm going to do a neuro assessment, let them know it'll probably take about 15 minutes, and then thank them for letting me do the exam. Next, I'm going to ask my patient their name and their date of birth and just match it with their ID band. And then I'm going to assess for any pain and then assess for any allergies. So just starting out, I'm going to start with my level of consciousness and then my mental status exam. So first, just looking at my patient, are they awake and alert? And then if they are, then I'm going to start asking my orientation questions. So for person, name and date of birth, place, I'm going to ask them where they're at, time, either the month or the year, and then situation, why they're here, either in the hospital or wherever they are. So then after that, so my patient would be alert and oriented times 4. Next, I'm going to just assess their mood. So, are they anxious? Are they just like, a normal mood? And then I'm going to test their cognitive ability, which I know I know in health assessment 1, we talked about doing like a mini cog test. So I think that you could perform that to just kind of get a baseline of what their cognitive ability is. Next, I would just kind of ask about their concentration. So I could ask them to do just like a 2-step problem. And then if they're able to complete that, then they probably have pretty good concentration. Next, I'm going to ask about their recent and remote memory. So if any of these could be related to like Alzheimer's disease, if they can't, if they're not able to tell you, like recent memory would be like, what did you have for breakfast this morning? And then remote memory would be like something that happened years ago, so just testing that, and then testing their judgment. So like let's say it's really hot outside and they have a bunch of clothing, like got a bunch of clothes on and they're sweating. Or let's just say they have put on a jacket or like a sweater and they come in the exam room and they're like visibly sweating. If they can like take that jacket off, then they probably have good judgment. If not, if they're just sitting there sweating, probably not so much. So then after that, I'm going to test for like abstract reasoning. So I would ask them like, hey, are you able to be trusted like with a car when you drive? Are you able to manage your finances? Kind of stuff like that. So next, moving on to just observing their posture. So I want to know if they're, like an erect posture. Are they sitting up straight? They're not like hunched over. I want to note their energy level. So are they calm? Body movement. So when they walked in the exam room, their arms should be moving in opposition. They should have a smooth gait. And then like dress and grooming. So you just want to make sure that it's appropriate for the situation. And then when you're speaking to them, just checking their, facial expressions. Are they appropriate to the situation? Like when you're talking to them. And then when they're speaking to you, just checking their speech for tone and then clarity. So make sure that they don't have any slurred speech or anything like that. All right, so moving on to my cranial nerves. So the first thing that I'm going to test is my cranial nerve number 1, which is my olfactory nerve. So what I'm going to do is just testing their sense of smell. So for example, if this was like a scented marker, then you could take the lid off and you could have them close their eyes and just kind of rub it under, not rub it, but like fan it back and forth under their nose and then let them tell you what the scent is. And if they were able to tell you what the scent is, then that nerve would be intact. Next is going to be cranial nerve number 2, which is going to be the optic nerve. So it's just testing visual acuity with a Snellen chart, which I don't have. But as long as they were able to do that, then cranial nerve number 2 would be intact. Next is going to be cranial nerve number 3. And cranial nerves number like 3, 4, and 5 kind of like all grouped together. So just like bear with me. But 3 is going to be the ocular motor. So that's going to be testing pupillary response. So you're going to be testing your pupils and then a testing for accommodation. So I can take these off for a minute. So let's see if I can. So you would just take your pen light and you would just shine it in your eye here. maybe. So Perla, you would be charting Perla. So Perla would be pupils equal, round, reactive to light, and that they accommodate. So the size, you know, you're noting the size. So 3 millimeters, they're round, they're equal, and then accommodation, and they do react to light, obviously. They constrict when I shine in. So then accommodation, what I'm going to do is I'm going to have my patient, so let's say I'm sitting in the exam room and I'm going to have them focus on something on the wall. So I'm going to say, can you look at that clock over there and tell me what time it is? So they're going to tell me the time, and then I'm going to say, okay, I have my pin light in front of me. I'm going to say, follow my pin light in and out wherever this moves. So what I would do is I would take this, and they had previously just focused on the clock. So I would have them take this, and I would follow it in, and I would have them follow and then back out, and then one more time back in, and then I would just have them follow that. And as long as they were able to follow that, then their then accommodation, they were able to accommodate. So as long as they're able to do that, and then that nerve, so cranial nerve number 3 would be intact. So like I said, 3, 4, and 5 are kind of like all together. So ocular motor we just did, but then you'd have trochlear, and you'd have the abducens nerve. So what you're going to do for these is you're going to test the 6 cardinal fields of gaze, sorry. So what you can do is you can either have them follow your finger or like a pen light. So you just have them, you say follow with your eyes and don't move your head. So you could hold this out and you would just go out. So you'd go follow, 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 and then you do it again on this side. So you'd say follow and then follow and then follow. So you're just doing like kind of like a star. So here's your middle, and you're just going out, 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 and then you're doing out, out, and out, because I know that's hard to see. So as long as those were, if they were able to do that, then those nerves would be intact. So ocular motor, trochlear, and abducens would be intact. So moving on to cranial nerve number 6 is going to be the trigeminal nerve. So I'm going to have them like clench their teeth. So you're testing like the masseter muscle. So you're going to clench. So I'm able to do that. And then I'm going to just test sensation. So I've got my cotton ball here. I'm going to have them close their eyes. And then I'm going to rub it on a side of like either their cheek or their forehead. Well, probably both. So you would have them close and you would rub it and you'd say, which side am I touching? And then you'd rub it over here and what side am I touching? And if they were able to tell you which side you were touching, then that would be intact. So trigeminal nerve would be intact. Next is going to be cranial nerve number 7, which is going to be your facial nerve. So you're going to have them smile. You're going to have them frown, which I feel like is really hard to do. Frown, okay. And then you're going to have them raise their eyebrows. So raise them up. You can even have them like close their eyes really tight and then raise them really, really high. So eyebrows are raised. And then if they're able to do that, then their facial nerve would be intact. So next is going to be cranial nerve number 8, which is vestibular cochlear. And this is going to be kind of like your balance and hearing test. So we're going to perform the Romberg test. So what you're going to do is you're going to have your patient stand up, feet together, arms at side. You're going to stand there, your patient's to stand there for 20 seconds. You're going to have them close their eyes. If they start to sway or they fall over before those 20 seconds are up, then they would have a positive Romberg's test. Sorry, I just dropped my pen light. And then, so you would want to note that. And then next you're going to do the Weber and the Rhine test. So the Weber test, so let's say this is my tuning fork. So you would strike your tuning fork and you would put it on top of their head. And then the Rhine test, so what you're going to do for this one is you're going to strike it and you're going to like hold it by their ear. And it's going to make like a vibration. And then once they stop hearing the vibration, then you're going to place it on the mastoid bone back here. So that's how you would perform that test. And if those were good, then those nerves would be, the vestibular cochlear nerve would be intact if they were able to do those without, any issues. So let's see, we just did 8. So cranial nerve number 9 and number 10. So that's going to be glossopharyngeal and vagus nerve. So you're just testing the gag reflex. So you just take a sterile, I can't even think of what it's called right now, tongue depressor. Sorry, I can't think right now. You're gonna take a tongue depressor, have them stick their tongue out, say ah, and then push the, you push it kind of far back in, and then if they were able to, elicit their gag reflex, then cranial nerve number 9 and 10 would be intact. So moving on to cranial nerve number 11, so that's going to be your spinal accessory nerve. So what you're going to do is you're going to push down on their shoulders, so you're doing resistance against the shoulders, and you're going to have them shrug their shoulders against your resistance. And if they're able to do that, then the spinal accessory nerve would be intact. And then last, you have your cranial nerve number 12, which is your hypoglossal nerve. I think I said that right, glossal nerve? I think so. So you're just kind of looking at like the mobility and like strength of the tongue. So you're gonna have them like stick their tongue out. So you would just have them stick it out. And then I would say just kind of like move it side to side would probably be sufficient enough. And then if they're able to do that, then the hypoglossal nerve would be intact. So next I'm going to test my motor and my cerebellar. So you don't have to repeat the Romberg test, but you could also do the Romberg test here if you didn't already assess it with your cranial nerves. So you're just kind of looking at like strength and tone. So just a couple of things you would want to have your patient, you could say, squeeze both of my fingers. That would be testing your strength. And then you would want it to be, you want that to be a 5+, because that would be your, obviously the strongest of the strength. And then you're gonna check for drift of your upper extremities. So you're gonna have your patient close your eyes, we'll close their eyes, and then you can have them hold their arms out here, and you're just looking for a drift. So you're gonna have them hold out their hands or their arms for 10 seconds, and then you're just gonna note any drift. So sometimes if their eyes are closed, then they can't always see if you're drifting, which could indicate like some weakness, or sometimes like our stroke patients have that. And then you can also check pronator drift. So you have your patient hold their arms out, and you just put your hands, no, because this is pronator drift. I'm sorry, I'm thinking of this going inward, but this is your pronator drift. Sorry. So your pronator drift is you're holding out for 10 seconds. Sorry, I'm confusing myself. And then you're just checking for just like any flaccid, like, if one arm is flaccid on a stroke patient, you would want to note that, and then you would be checking for like any spastic movements. So next, for lower extremities, you're also going to check the same thing. So you're going to have your patient, you can have them close their eyes too, but you're going to have them one at a time hold their leg out. So let's pretend this is their leg. I guess I could show you, but okay, it's really hard for you to see here. So you would have them laying down supine, and then you would have them hold their leg up, and you would count to 5, 1, 2, and it would be like a slower kind of count, and you would want to note any drifts. And then same with the other leg. And if you have them close their eyes, then maybe they won't be able to see like, oh, their leg is drifting. So, so that kind of tests strength. And then you also want to do, if I can put my foot up here, you want to do plantar flexion. So you want to put your hands down right here and have them push down. And then you can also do dorsiflexion as well to test for muscle strength. So then next after that, I'm also doing, so for the upper extremity, I forgot to test like tone, self-identified break. I forgot to test tone for the upper extremity. So you would just take the elbow and you would do like passive range of motion, and then that would be able to give you like your tone. And then same for the lower extremities, you're just gonna do that on the knee. So testing tone, lower extremity, you're just gonna take the knee, which I don't know, and then you would have them like supine, and then you would just like take their knee, and you would just kind of do like active or passive range of motion. So you would just pull it in, and then you pull it like out, back in, and then back out, and then that would be testing tone for your lower extremities. So after I just tested my tone and my strength, I'm gonna test my coordination. So I'm gonna have them do a finger to nose test. So what I usually do is I will have them, so I have my finger out right here. So let's say this is, you know, I'm the patient and I say, reach out, touch my finger, and then touch your nose. So you're gonna have them touch your finger, touch their nose, and then I like to move my finger. So, you know, if you go over here, touch my finger, touch my nose. And if they feel like they're missing, like let's say they're hitting over here or they're not hitting your finger, then that could indicate some like ataxia. And then you can also do like a heel to shin one too. That can assess ataxia as well. So next, what I'm going to do is just test my sensory. So I have my sharp side and my dull side over here of my contact applicator. So I'm gonna have my patient close their eyes and I'm just gonna touch kind of like various places. So I'm gonna touch like the forehead, the cheek, the chin, kind of like clavicle area in here, and then like lower, you could do lower extremities and you can do upper extremities as well. So, and then you can do like sharp and dull. So let's say I close my eyes and I'm doing here, so patient would say dull, and then let's say I switch it and I do here, then they would say, you know, sharp. And you would just test those areas and just see sharpness and dullness on each side. So after I do the sharp and dull, I'm gonna do the sensation with my cotton ball as well. So, so this is kind of like what we did with the facial, like the cranial nerve. You're just gonna do, have them close their eyes and just kind of rub it and just ask them like which side of the face that I'm touching. And you can do it kind of in the same spot. So like clavicle area, upper legs, and then lower legs. After that, so I'm going to test for, and I cannot say these words, so sorry. But I'm gonna test for graphesthesia. So what I would do is the graphesthesia I would have, so this is really hard to like, okay, so let's say I have my patient's hand right here. I'm gonna have them close their eyes, and let's say I'm writing like this number. So I wrote a 5, and I would want them to tell me what I'm writing in their hand, but make sure that their eyes are closed, and then make sure that it's, you know, that it's the same way that they are able to know that it is a 5. And then the next thing I'm gonna test for is going to be stereoagnosis. I can't even say that either. So let's say I don't have like a key or anything, but what you would do is you would put, so let's say this is, I mean, this is my cotton ball. I guess you could use this, probably not because you had been using a cotton ball. But something like distinct like a key would be really easy to do. So you just have them close their eyes, you put it in their hand, and then when they feel it, they should be able to tell you what it is. So if this was my cotton ball, you put it in their hand and they would say, okay, this is a cotton ball. And they would be able to, you know, differentiate what, you know, what it was, or if it was a coin or you know, whatever. So next I would be testing peripheral neuropathy with a tuning fork, which I don't have. But what you can do is you can strike your tuning fork and you can actually put it on like the great toe. And sometimes if they can't feel that vibration, then that can indicate some peripheral neuropathy. So next I'm going to do my deep tendon reflexes, and I realized when I was practicing that this is very hard to do on yourself. So I'm going to try my best, and I'm going to use the kind of edge of my stethoscope right here, but I really wasn't able to elicit any reflexes, and I don't know if it's because I'm doing it on myself or what. But the first one I'm going to do is my biceps one, and I actually, I was watching a video before I recorded this, and she she told me, I was watching this like Southern RN video, and she was like, if you can't find the, like if you're not sure where to go, if you have your patient like flex wherever you feel that like cord like, that's where you would test. So this is gonna be where I'm gonna test my bicep one. And if I just kind of have it relaxed here, let me scoot out a little bit. So just kind of relaxed here, and then when I hit it, you should see a little bit. I know it's so hard to see, I'm sorry. So my fingers, like They went up a little bit. I just don't know if I'm, it's hard because you don't have like a hammer to test. So that for me is really hard. And then the tricep one, so the tricep one, you should be holding your patient's arm when you're testing it. So you should have them totally relaxed. And I think that's another reason why I couldn't elicit mine, because I can't fully, I don't have anyone to hold my arm. So let's pretend that I'm holding my arm. And this one is kind of like right in here. And if my arm was totally relaxed, then you would be able to see that, that tendon reflex. But like I said, I can't, it's really hard to do when you don't have your patient relaxed. So the next one is gonna be the brachioradialis. So this one, if you have them just kind of rest their hand like on the table, if you look for your, what is this? Oh, I can't think of what it is. Like your radial, like the little bone here. If you go like 2 centimeters, that kind of indicates where you would test the reflex. And this one you would kind of see like a little bit of reflex in the thumb if it was completely like relaxed, which mine obviously is not. So you would just kind of tap on that and you would see a little bit of a reflex. And the next is probably the easiest one, would be the patellar. I don't know if you can see this one. I'm gonna try my best. Okay. So patellar one, you just wanna have them sitting down in a chair and just kind of relaxed. And then that one is really easy. Okay, so my patellar one, and then my Achilles, I don't know how I'm gonna show this one. Maybe I can show like the back here. Okay, so then you would want to have your patient like supine when you're doing this, but then you just kind of, like, I don't know if it's gonna work because my foot's not relaxed, but you would just tap kind of right there in the Achilles region. And then after that, so that sums up my neuro assessment. So I would just reassess my patient's pain. I would offer them anything. I would ask and see if they need anything before I left. And then I would thank my patient for letting me do my assessment. And then, of course, do my hand hygiene before I left the room. I want to make sure that the bed is in the lowest position, wheels are locked, bed chair alarm is on, and that their call light is within reach, and then that their side rails are up at least ×2.